Okay. Good morning, everybody. All right. I am Josh Sharfstein. I am the co-chair of the Roundtable on Population Health Improvement at the National Academies of Science, Engineering, and Medicine. I'm also the Vice Dean for Public Health Practice and Community Engagement at the Johns Hopkins Bloomberg School of Public Health. I'm very excited to welcome our audience here in Oakland, California at Preservation Park. Special welcome for our California funders at the California Endowment and Blue Cross Foundation, and everyone else who made it out here from all across the country, and everyone who is watching either live on webcast or on video later. So since February 2013, the Roundtable on Population Health Improvement has been providing a trusted venue for leaders from the public and private sectors to meet and discuss leverage points and opportunities for achieving better population health. Our vision is strong, healthy, and productive society which cultivates human capital and equal opportunity. This vision rests on the recognition that outcomes such as improved life expectancy, better quality of life, and health for all are shaped by interdependent social, economic, environmental, genetic, behavioral, and healthcare factors, and will require robust national and community-level policy change and dependable resources to achieve it. Now, this is the Roundtable's fourth workshop entirely dedicated to exploring the interface between health and education, and I'm sure I'm not the only person here that in their daily life somebody says, like, you know, education's pretty important for health. And I go, I know, you should tune in and watch the meetings that we have where we talk about this. This has gone from, I think, an issue that is a bit on the margins to a much greater appreciation of the vital importance for health and education to come together. Information about the other work on this topic is available at the registration table or online at the website of the Roundtable. There was recently a report from the National Academies titled The Promise of Adolescence, Realizing Opportunity for All, which talks about the incredible opportunity that adolescence is for improving health in society generally. Information about the report is in the workshop resources and also on the registration table. Now, today's workshop on middle school is the first middle school and population health major meeting that I have heard of. It's possible that there were others, but I really appreciate all the people coming together to really focus on this topic. Middle school is often overlooked when people talk about kids, and so this is a great focus. And it was put together by a great team of planning members, including Joaquin Tamayo from Education Council, Joanna Williams from the University of Virginia, Diane Whitmore-Schanzenbach from Northwestern University, Kimberly Charas from the National Association of State Boards of Education, Christine Thielen, the chair of the Board of Trustees for the Association for Middle Level Education, and Ann DiBiase from the Trust for America's Health. Note that that was a pretty integrated education and health group, and it was a lot of fun to be a part of. We received terrific staff support from Carla Alvarado, Alina Bachu, and Brittany Davenport from the National Academies, with a particularly tremendous amount of work by Carla Alvarado in putting today's part together. I think we can pause to all thank Carla before we go on. Okay, so let me say a few words about the organization of the day. We're going to begin with panel one, which is called The Middle School Years, a 360-degree View, whose objective is to give our audience here and online a holistic sense of the young adolescent, including developmental needs, issues, and considerations, as well as the social environments and programs and policies designed to have a positive impact on children at this stage. It's kind of like setting the scene. Panel two is called Middle School Inside Out, and this is going to highlight how educators and administrators engage in activities that modify the standard traditional approach to middle school to support the health and well-being of students. Panel three is about multi-sector support, highlighting how other sectors collaborate with middle schools to support the health and well-being of students. And panel four is called The Big Picture, which will provide the audience with an understanding of large-scale issues around middle school, from financing efforts to nationwide support for educators and administrators who are improving the middle school experience. So we've got very, very interesting panels, and then we're going to have a very interesting activity at the end, which is going to be quite interactive. So the event is being recorded and webcast live. An independent rapporteur will prepare a publication based on today's event. The workshop proceedings will undergo external peer review and will be released to the public in 2020. If you are tweeting, thank you. No, that's not. No, if you are tweeting, we appreciate it. Please use the hashtag #PopHealthRT. PopHealthRT. That way you can follow the conversation, you can contribute to what's happening in the room if you're online, and we will be taking a look at that to see if there are questions that come in for various panels. We ask that if you go up to a microphone during discussion periods, please state your name and affiliation. And it is a great pleasure now to introduce Michelle Larkin from the Robert Wood Johnson Foundation to get started with introducing our initial keynote speaker.
Thanks, Josh. So I'm going to ask that Phyllis and Joanna and Joaquin join me up here. I'm not Josh. So as everybody's coming up on the stage, I just want to reintroduce myself. I am Michelle Larkin. I'm the Associate Executive Vice President at Robert Wood Johnson Foundation, which is based in Princeton, New Jersey. We do a lot of work on systems and policy change. So as we moved into planning for this workshop, and I am a member of the Population Health Roundtable, as we moved into planning this workshop, I thought, this is a table that I need to be at. We do a lot of work at RWJ on systems and policy change. We don't do a lot of work around middle school ages, but I am the mom of a middle schooler, so I thought today would be an excellent opportunity for me to come and learn more about how I can be more supportive to our school system, our education system, both in my work life but also in my personal life, and I hope everybody brings that lens to the conversation today so that we can learn from each other and push our thinking. I'm excited to be able to introduce Phyllis Fagel. She's going to walk us into the world of middle schoolers, what it's like to be a middle schooler. Phyllis has the unique glimpse into this world as a counselor at Sheridan School in Washington, D.C. She responds to the needs of students, parents, educators, and administrators. And as you can imagine, those are not always the same needs or issues that, and they're not in the same developmental places all the time. So Phyllis is really going to be able to help us dig in and see what that complexity looks like as it comes together. She has shared her insights in her best-selling book, Middle School Matters, the 10 key skills kids need to thrive in middle school and beyond, and how parents can help. And Phyllis, thank you for starting the day off for us. I just want to make a note. I'm going to introduce our other two panelists after Phyllis talks, and we're going to hold questions until everybody has had an opportunity to speak, and we'll have plenty of time to do that at the end. So please join me in welcoming Phyllis.